Hi, I'm Dr. Michael Winters, Winters Wellness Center, Chiropractic Redefined, and I want to talk to you today about our new back on track unit. This is just an incredible piece of equipment that works crazy good. There's lots of traction on the market, and traction has a very valuable effect. If we look at this spine, we can see how traction can open up the joints, can open up the disc space, so that the disc can come back into place better, can open up the gliding joints, take pressure off the nerves. Traction can do a lot, but this is way different because this not only provides traction, but it provides programmed lateral flexion, where we can actually laterally flex the spine as we program the instrument. This gets a lot of movement, a lot of mechanical input to these joints in your spine. And it seems to have almost a full spine effect in that it may traction out or take tension off the meninges or coverings around the spinal cord while you're in the chair. Everybody I've put on this chair loves it. And everybody that I've put on the chair with a weakness in their foot that was due to a nerve problem in their back has come off the chair with their foot stronger. This is just an incredible piece of equipment. I'm going to actually show it to you today. I'm going to do it on myself. I didn't plan ahead enough to have my wife or anybody as a patient. But I want to share it with you and let you see how it works. So this is the back on track unit. A person just sits back into it, and this goes behind the head. Normally a staff person will be doing this for you. I have it already set for myself. I'm going to push start, and it's going to take the chair, it's going to go recline into the traction position. And then typically we'll strap the legs just lightly, but there's no other straps around your body at all, so you're not harnessed in by anything. That's one of the things that makes this so neat. Then once we get down, we'll put the armrest under the arm. Again, that's the point that you traction from. Now in just a few seconds, this is actually going to traction me out, in my case about 3 inches. That's a variable amount of traction that we can do for each person. So it's going to traction me out 3 inches, and then it's going to rest there, and then pretty soon it's going to start in lateral flexion motions, and so it will laterally flex me to the left and then to the right. This unit is extremely comfortable. Again, it's very good for people with low back, herniated discs, any kind of what we call facet joint or gliding joint problem in your lower back. Now I'm laterally flexed to the left. That's opening up the right side of my lower spine, and we can go just to one side or just to the other side. If a person has a scoliosis, we can program it to just go to one side to help reduce the scoliosis. I've heard of doctors having tremendous improvement in patients with scoliosis using this equipment. Now we're going back to the center, and then in just a moment we're going to traction to the right. This is just such a relaxing piece of equipment and so effective at helping relieve lower back pain. And what I'm finding also is that when I adjust people after being on the back on track unit, they need less adjustments, less areas. They adjust much more easily and quickly. It's just a phenomenal piece of equipment, and there's only, as far as I know, maybe 20-some pieces of equipment like this on the market in the United States. So we've really caught the cutting edge of this equipment. So I'm going to stop it here now and bring it back up. So it's going to come back in. And then in a few seconds it'll straighten me back up. The normal session would be 10 to 15 minutes. I just wanted to give you a brief demonstration so you could actually see the lateral flexion motions of this equipment. That's what makes it so unique. That's why it's so powerful, and that's why we have it at Winters Wellness Center, Chiropractic Redefined.